So this lightboard video aims to go through the arterial blood supply associated with the lower limb. So firstly, if we start off, if you can recall from the blood supply of the upper limb, we have the abdominal aorta piercing through the diaphragm. So this is our diaphragm over here. So the abdominal aorta will pierce through the diaphragm. As soon as we reach the level of the pelvis, so we're looking at the superior iliac crest, the abdominal aorta is then going to bifurcate into the common iliac arteries. So over here we're going to have the left common iliac artery. And again, I'm using abbreviations, but the full terminology is displayed at the bottom. And we have the right common iliac artery. So recall when we have any artery that is called common or has common in the name, it usually means that it's going to split or bifurcate at some point into the internal and external equivalent. So what happens with our common iliacs is it throws a collateral branch. So we're only going to concentrate at drawing out the right side. So we have a collateral branch which is then called our right internal iliac. So the internal iliac artery is supplying blood to the pelvic inlet and the internal structures. It's going to continue over on this side as the external iliac artery. So the external iliac artery is supplying blood to the outer or the external surfaces of the pelvis, as well as the major pelvic muscles and the gluteal muscles. As soon as we reach the level then of the inguinal ligament, so we'll write in our landmark, the external iliac artery is then going to continue as the femoral artery. So it's the femoral artery as we're passing through the femoral or the anterior thigh region. So let's just write this in. The femoral artery has a major collateral branch, which is going to be running laterally and supplying the posterior aspect of the thigh. And this is going to be our deep femoral or the profundus femoral artery. So what happens with the femoral artery then is as soon as we reach the soft tissue or the muscular landmark referred to as the adductor canal, the femoral artery will travel through this adductor canal and pop out the posterior aspect of the thigh through a little hiatus known as the adductor hiatus. As soon as it enters this posterior region, we then call this the popliteal artery. So popliteal because it's running through the popliteal fossa and the popliteal region of the leg. As soon as we reach the inferior aspect then of this popliteal muscle, it's then going to bifurcate or terminate into the tibial arteries. There are two major tibial, so we have a posterior tibial and we have an anterior tibial artery. So as the names imply, the anterior tibial artery is running through the anterior compartment of the leg, and the posterior artery is going to be running immediately posterior to the tibia, and it is going to be supplying the posterior leg and foot. The posterior tibial artery has a collateral branch, which is then going to be the fibular artery. So although I've drawn it on the wrong side over here, the fibular artery, also known as the peroneal artery, is going to supply the lateral aspect running through or running with the fibula. If we look then at the terminal branches or the termination of the anterior tibial and posterior tibial, these are actually going to terminate at the level of the foot. So as soon as we get to the level of the malleolus of the ankle, it's then going to supply the arches of the foot. So specifically, the posterior tibial will terminate as our medial and lateral plantar arteries. So this one over here on the lateral aspect is going to be the lateral plantar, So this is supplying the lateral arch of the foot. And then this one over here is going to be the medial plantar. What happens with the anterior tibial artery then is it's actually going to terminate as the dorsalis pedis. So because I'm running out of room, I will draw it up here. So just know that the termination is that it's going to continue as our dorsalis pedis. And this dorsalis pedis artery is then going to help to form what's known as the arcuate arch, or the arcuate artery in the foot. And this arcuate artery is then actually going to supply the foot and go on to supply the metatarsals and the digits. So I hope that this provides a quick overview of the blood supply associated with the lower leg. As you'll see, it's a little bit easier to remember compared to the blood supply of the upper limb, but it's very important that you know the course, so you know the origin and the termination of each of the major vessels, as well as the skeletal or the soft tissue landmark that is going to be the transition point between any two vessels. Thank you very much for your attention today.